Good afternoon, ladies and gentlemen. My name is RIKA FATMADONA. I would like to present you our literature review that discuss about palliative care and end-of-life care in Indonesia. It is a study by me, Rika Fatmadona, and Ajahn Kitikorn Nimanat. This is the part of my study in PhD in Prince of Songkla. The introduction. Indonesian has a wide area that is around 17,499 island, which has consists of 30 provinces. So the population has dense population with 272.23 million in June 13, 2021. So Indonesian has various ethnicities and religions by that. According to the data of WHO, that most of the disease in Indonesia need palliative care. There is non-communicable disease such as cancer and cardiovascular. So Indonesia situation about palliative care, it is already exists from 1989. It is due to cancer incidents that are getting higher and there is no pain relief. So the PC service is getting needed because 17% of the cancer patients is in advanced stage. So somehow PC service in Indonesia established in several public hospitals. Whereas prediction most of patients will die in the hospital settings, suffering because of the symptoms of their illnesses, and still unable to meet the needs of patients and their families. Indonesian position, according to WPCA, that Indonesian is the third categorized, that is as an isolated palliative care provision with palliative care growth was not well funded and limited in number compared to the size of the population. Where from the quality of death index, Indonesia has 53rd rank in PC from 80 countries. It means that Indonesian PC progress remains slowly. In this presentation, I would like to tell you about the objective, methodology, result analysis, and conclusions. The main objective is we would like to present to answer the question, what is the present PC and EoL care situation in Indonesia, the current studies and the challenge. The methodology, this is a literature review that recruiting articles from database Journal, Medline, SG, ProQuest, PubMed, and Grey Literature. We took 4 journals and articles and theses that relevant in study of palliative care EoL care by Indonesian nurses in a hospital setting from 2016 until 2021. The language is English and Indonesian in full text. So we took each article and checked the presence of keyword exists and make sure there are answers to propose the review. So the results, we found only 23 articles that eligible, which is 15 in English and 8 articles in Indonesian. This table is present about the study classified that from 23 articles that we found. So this is the findings. According to the situation, palliative care service established in several major cities where most of the facilities for cancer are located. So the progress of the centers varies in terms of personnel, facilities, and the type of service delivery. It is because of palliative care concept and implementation are not really understood by some healthcare practitioners. However, the basic concept is understood by many. So the second situation is the local government plays an important role in developing palliative care, whereas the government policy about opioids has also become a significant barrier in providing good palliative care. Government in local situation is they should run some regulation in their local. And for the current studies, we found that some studies talk about the palliative care knowledge variant in nursing, whereas some of the studies, the PC knowledge relative low in the nursing. And then for the studies also discuss about nursing care to end-of-life care patients. The nursing serve the care emotional, give emotional care for the patients, emotional approach to the patient, but somehow they have difficulties in communicating end-of-life care for patients and families. And then the study from instrument for palliative care and EoL, such as PCKI for palliative knowledge, and then for fact chart for end of life, and then some spiritual instruments. And there is a study that state that the nurses do not know about the nursing competence in palliative care because of they do not know about the regulation that already come out from the Ministry of Health in 2007. So the barriers, we found that there is still limited health workers that has an ability and good knowledge in palliative care. So it means we have knowledge barriers. And then there is a lack of collaboration and also cooperation between the health workers. And the barriers from the government, we talk about the funding that exists from the government for PC development, and also the government has some problems in distribution the health worker around Indonesia to give PC. And for the problems in culture, culture of strong familiar support. So we have discussion. The financing of palliative care should be integrated into national health system budgets at all levels of care. So Indonesia already put this palliative care into a national health system. But about the budget is still limited. So the palliative care should be integrated into the curricula of all new healthcare professionals and community care workers training. The problem is the nurses have already learned about palliative care after 2017. But before that, they do not learn about palliative care. So the palliative care only got by training. And then the continuing to establish a robust evidence base is crucial component to building commitment to greater access to palliative care for those who need it. So we need more research in palliative care. The relevance of the study will benefit for palliative health team, researcher, government, and other parties that involve improving the quality of Indonesian people. It is valuable information that can help the way, change the way we see education today. Nurses have the potential to play a more central role in the provision of palliative care. Increasing nurses' knowledge is pivotal because they can educate and empowering families in jointly caring patients. And then nurses can improve palliative care by exploring the cultural variation. So the conclusion, PC and EoL care Indonesian nurses need to improve by increasing their knowledge, attitude, and skills. Indonesia need more collaborative and cooperative work to fulfill the demand of PC. And then further research question, how is the practice of PCL care that exists in Indonesia with all cultural variation? How is it perceived with the nurses, patients, and families? Will we see the increase of the score? Will all the support component, government, other healthcare stakeholders able to improve palliative care in Indonesia? So I think we need it still need a lot of improvement in palliative care in Indonesia. So it takes time. I think that's all for today. Uh, we can have a discussion after that. Thank you so much.